The current challenges surrounding the COVID-19 pandemic have caused a huge amount of fear, anxiety, and uncertainty for all of us. Today on Demystifying Medicine, we will talk about the impact of the pandemic on mental health, including who is the most at risk and what you can do to improve your mental wellness during this difficult time. While social distancing guidelines help prevent the spread of the virus, it has also led to the termination of social gatherings, closure of small businesses, and increased financial difficulties due to layoffs and medical expenses. In the US alone, there are more than 20 million people who have filed for unemployment from January to April. Studies have shown that large-scale traumatic events that carry economic and social consequences can dramatically increase the mental health burden in the affected populations. So if you're feeling stressed, depressed, or anxious during the pandemic, you're not alone. A global study has shown that 1 in 4 people in the general population experience some level of depression. Another study found that the rate of depression is 3 times the pre-pandemic levels. And for populations that are under increased pressure or exposure risk to the virus, such as university students, frontline healthcare workers, or COVID-19 patients, the rate of mental illnesses is even greater. By some estimation, around 50% of university students, 1/3 of all healthcare workers, and half of COVID-19 patients experience depression, anxiety, or sleep disturbances. Major risk factors in these 3 populations include socioeconomic status, education level, and whether they're living with others or living alone. People who are under increased pressure or exposure risk and who also have low socioeconomic status, are uneducated, or live by themselves are at increased risk of developing mental health disorders. So how do you regulate your own mental health during the COVID-19 pandemic? Physical activities such as biking, walking, sports, and even dancing have all been shown to reduce anxiety and depression. Exercising not only improves mood and mental health, but has also been shown to improve self-esteem as well as attention and memory. Sleep may also play a huge role in improving mental health. This is especially important during the pandemic, while insomnia and sleep disturbances have been shown to be common occurrences in many at-risk populations. Studies have shown that higher quality of sleep may significantly improve symptoms of stress, depression, and anxiety. Interestingly, exercising has been shown to significantly improve sleep quality. It is recommended that 7 or more hours of sleep per night is needed to maintain optimal health in adults. Lastly, screen time is highly associated with mental health. While screen time is unavoidable given the transition to an online work and learning environment, the internet is also filled with misinformation and divisive content. Reducing unnecessary screen time, especially on social media, can have a profound and positive effect on your mental health. With these tips in mind, by incorporating daily exercise into your routine, getting sufficient amount of sleep, and reducing unnecessary screen time, you can markedly improve your mood and mental wellness. You can evaluate your own mental health using a variety of widely accessible screening tools online, such as the PHQ-9, which screens for depression, the GAD-7, which screens for anxiety, or PSQI, which screens for sleep disturbances. If you decide that you would like some help with your mental health, programs such as ementalhealth.ca, Crisis Services Canada, and the US National Helpline all provide access and referral to mental health services free of charge. You can also ask for referral to professional mental health services through your primary care providers. Here are several more resources for seeking mental health advice in both Canada and the United States. Hang in there, we will get through this pandemic together.